Another truly unique procedure that we perform here at Premier Image is hair transplantation. So I'm going to give you a couple of terms that we all are familiar with. Doll's hair, the hair plugs, cornfield look to the hair. Those days are gone. Those are from the late 80s and 70s when large plugs of hair were placed from the back of the head and put on the front, and it literally looked like little manhole covers of hair. It was obvious that you could spot this from a mile away. The modern equivalent to this is something called microfollicular grafting, where we take one hair at a time and place it to rebuild the hairline and density on patients that are losing hair. This is completely imperceptible. In fact, you would not know someone had a transplant if they were sitting right next to you when it's done with this technique of microfollicular unit grafting. And how is this done? Well, if we think about it, has anyone ever seen a bald person or a bald man who didn't have hair in the back of their head? The answer is no. The reason is the hair on the top of the head is genetically different than the hair in the back of the head. This hair really reacts to the testosterone levels in the body. So that's what we call male pattern baldness. So what we do is we take the hair from the back of the head and transplant it to the front. That hair does not know that it's been moved, and it grows there for the whole life of the patient. How it's placed is really the art of the technique, where we redesign hairlines on patients, add density to someone who's thinning the hair. We do this to the front of the scalp, the sides of the scalp, the crown areas, depending on what the patient needs. Oftentimes we'll manage them medically with either some Rogaine to the area to help thicken the hair follicles themselves, and we also prescribe Propecia to help with the health of the follicles that we transplant. And transplantation is not just for the guys. We see a fair amount of ladies coming through also with thinning of the hair, where we will manage them medically to get their hair thicker, and then oftentimes, if need be, we will transplant some women also. So it truly goes across both sexes in that we see hair issues affecting people's appearance. And this is really, to see if this is right for you, we have you come in, have a consultation, and take a look and see how your hair density is in the back, and make sure you be right for a transplant.